walking shoe, running shoe, things like that too. You had a question?
Yeah, when you do bunion surgery, correct?
Yeah.
Do the factors that cause that bunion in the first place make it recur?
You always have the risk that you can have bunions that recur. The older you are in age, the less chance you have of your bunions to recur. But it's always a possibility, whether it is the ligaments around the joint. Even though you release them, they can scar in, and when they scar in, they can pull the toe back over again. So that's always a possibility. The other thing is since you have numerous joints in your foot, even though if you address one joint, sometimes the joint in front of it can also have some laxity or looseness to it. So even though you address everything here, the looseness of the joint in front of it can cause that to come back also. Yes.
I didn't remember you saying anything about calluses. Is there
calluses?
Calluses, and I can't figure out why.
Yeah, calluses are very common to have. They usually come up with abnormal forces on that part of the foot. If you have a callus, for example, underneath the little toe or underneath the big toe, that's an area where it takes up extra load, whether it is from shoes, whether it's your bone structure that you have, whether it's your occupation. Those are all things that can play into it. A lot of times that once a callus starts, it's very, very difficult to get rid of it. Usually the way that I do it is have you use either a pumice stone or a pet egg at home, keeping that in check. I do have some patients that come in every 3 to 6 months to get their calluses shaved down to kind of give them a fresh start in terms of being able to take care of them at home. You can... Yeah, that will help keep things softer. Yeah. So also padding. If, for example, as patient gets older, they lose the fat in the front part of their foot, causing their bones to be more prominent. Well, your body's way of trying to protect that is by creating more skin, so it creates a callus. So I do have patients that have no fat in the front part of their foot, but they've got calluses there. And that's just your body's way of doing it. And what you do is you end up with a gel insole or a soft cushion insole, just to provide some cushioning, and those need to be changed out every few months. Any other questions? Yeah.
Like 20 years ago, I broke my ankle.
Mm-hmm.
And the doctor told me I had an extra bone in my foot and it needed surgery.
Okay.
So I was young and dumb and I took my own cast off and never went back.
Okay.
And now this part kills me continuously. And I don't notice it, but when I'm driving,
Okay.
I continuously have to take it off because the pressure, and I always have to crack it. When I'm laying down at night, it drives me nuts.
Okay.
It hurts so bad, and I just have to crack it. And what is that?
Now,
My own fault?
how do you feel? I'm not going to answer that question completely, because even if you break your ankle, it's a break through the joint a lot of times. You can develop arthritis in a faster way from that. Now, if, let's say, you're walking on uneven terrain, walking on grass, walking on gravel, how do you deal with that?
Oh, I don't do those things.
Okay.
Yeah.
So you probably have arthritis not just in the ankle, but there's also another joint underneath the ankle, which allows you to walk on uneven surfaces. So you probably have arthritis in both of those. Treatment for that is either bracing, just like a regular ankle brace. A lot of times we'll do it. The other thing you can always do, physical therapy sometimes will help you with the mobility, but your mobility, if you don't do the program at home, then your mobility is not going to come back. Last but not least is always surgery, where you go in there and you fuse that joint. I would hesitate to fuse the ankle joint unless you really have pretty significant arthritis. Yeah. Yeah.
But it also drives me nuts that I continuously can't put pressure on it for so long.
Yeah.
And I mean, I'm forever going like this, and everybody makes fun of me, whoever's driving with me, because
you're trying to keep the joint loose.
Okay.
Yeah.
Thank you.
Sure. Yes.
What can you do for arthritis besides exercise and medication?
Orthotics or bracing, and other than that, you can always use stuff. There's patches you can use. Some of them have lidocaine in them. It's called a lidoderm patch. It's usually with a prescription. You can put that on. Sometimes icy hot helps. Not all. Sometimes that helps. The other thing is you have it. So.
My ankles bother me during the night mostly. I can't hardly touch them on the sheets.
Now, how does it feel during the day when you're walking around?
It's fine after I get up and walk around.
Walk around for a little bit. Okay. Circulation issues?
What?
Circulation issues? Has anyone taken a look at that recently?
No.
Okay.
How can you improve circulation is what I'd like to know.
A number of different ways. One of them is the more walking you do, the better off you are, because what will happen is if you have a blockage in one area, your body will create new blood vessels around it. It's not as good as your original vessel, and then a lot of times it will come together farther on. That's one way of doing it. That's something that takes years and years, and your body adjusts to it automatically. The other way of opening things up relatively quickly is with a vascular surgeon. He can go in through your groin, put a little balloon in, open things up. You can put a little stent into the vessel to make sure that stays open. If he takes an angiogram and notices that you have a bunch of little knots all the way going down your artery, then you're probably better off where he'll go ahead and actually bypass you. So that's the way you get more blood down there. Yes?
For posterior tibial tendonitis,
Mm-hmm.
after you mobilize the patient for a few weeks, do you want us to follow a weight-bearing protocol, physical therapy?
Usually it really depends on the patient. Some patients progress relatively quickly through therapy and they do well. Some of them just take a little bit more time, and with those I'm a little more cautious. If I suspect it, I usually do get an MRI to see, is it torn, what's the extent of the tear, or is it just inflammation. If it's inflammation, I will be more aggressive in therapy to get them moving faster. If it's more of a tear, I offer them therapy kind of as a stopgap, and if that works really well, great, they don't need surgery, but a lot of those patients also need a brace, whether it's a lace-up brace or something that's called an Arizona brace, which is a very fancy custom-made one that's got laces to it.
So
It's tolerated, yeah. Yes?
I'm trying to figure out what effect disproportion, body parts being disproportionate to each other would have on feet. Like I was noticing a while back that when I sit in this position, one knee is 1.5 inch higher or lower than the other.
Okay.
They're not even. So does that cause something that would affect my feet?
It can, but it also depends on the entire length of your limb, so going all the way from the hips all the way down. So if, for example, if you have your lower leg is 1/2 inch taller on one side, well, you got to see if your thigh bone on the other side is 1/2 inch longer. So as long as things are staying in balance, it's usually not an issue. Any other questions? Yes?
What about these rubber shoes, and I'm sitting here trying to think of the name without
Thanks.
any backs in. What do you think about those?
The Crocs?
Crocs.
Yeah, I think they're very good shoes in terms of giving you some arch support. They are very comfortable to wear. If, for example, if you are diabetic, and I'd rather have you wear those in the house than have you go barefoot in the house. So they do provide you with some type of protection, a barrier between the ground and your foot. My kids have them, my wife has them, so they're happy with them, and I don't see any issues or problems. The fact that they're open back makes it very easy to have an indoor type of a shoe. So you come in the house, you take your shoes off, you slip them on real quick. If you need to go somewhere else, you slip them on, slip them off. So from that aspect, I think it's really good to have.
I see them on the street all the time.
Yeah, you can have them in the street. Some come with fur. You can have that for your winter Crocs, if you want to call them that. So you can have that, keep your feet warm. So, anyone else? Yes?
How about like if you have dryness in your heel?
Dryness in your heel is very common. A lot of times it is more common in the winter than in the summer because the humidity. What I tell patients is use Vaseline dressing. Use the petroleum jelly, not the intensive care hand lotion or anything, but the really greasy petroleum jelly. Put a considerable amount on your heel. Wrap your heel in some saran wrap and put a sock on and sleep with it like that. And then during the day, put some Vaseline on and just a sock. Go about your daily routine. If you have hardwood floors, tile, ceramic, be careful so you don't slip So when you put the Vaseline on, that's why I have you put the socks on right away. And that works very well, especially in the wintertime. If you have cracks in your heel, it will take a few weeks for them to go away, but they will go away. Anyone else? All right. Thank you very much. Thanks for coming.